Hi guys, we're going to talk about chapter 4, and this chapter is going to focus on how to apply ethical decision making as a critical leadership role for managers. So we're just going to get started here. So ethics is the systematic study of what a person's conduct and actions should be with regard to self, other human beings, and the environment. The justification of what is right or good, and the study of what a person's life and relationships should be, not necessarily what they are. So ethics is the way a person approaches and solves ethical dilemmas. It's influenced by their values and basic beliefs about rights, duties, and goals of all human beings. Ethics is considered with doing the right thing, although it is not always clear what that right thing is. In an era of markedly limited physical, human, and fiscal resources, nearly all decision-making by nurse managers involves some type of ethical component. Multiple advocacy roles and accountability to the profession just further increase the likelihood that managers are going to be faced with ethical dilemmas in their practice. This slide just shows how both legal and ethical can be seen together, but clearly could be different because of how each are identified. So when we think about legal and ethical, they are not the same. Sometimes it's difficult to separate them, but they are definitely different. Legal controls are generally clear and philosophically impartial. Ethical controls are much more unclear and very individualized. In addition, nurses' moral lives are growing in complexity given rapid changes that are the result of scientific advances, a growing business ethos, and technological processes aimed at standardizing patient care. So at times, nurses believe that they cannot respond adequately to the ethical issues that they encounter because of their enormity responsibility to continue to care for patients despite the obstacles that are set before them. So what are some of the moral issues faced by nurses? These include moral indifference, moral uncertainty, moral distress, moral outrage, and ethical dilemmas. When we think about moral indifference, this is an individual question why morality in practice is even necessary. So a nurse who is both unconcerned and uninterested in alleviating a patient's pain, or unconcerned or uninterested in any form of violation of patients' rights, means they are indifferent. When we think about moral uncertainty or moral conflict, this is an individual that is unsure which moral principle or values apply, and may even include uncertainty as to what the moral problem is. So this could be a disagreement in goals of care, perceived treatment outcomes, resuscitation status, when to call a code, uncertainty, or conflict. On the other hand, moral distress occurs when the individual knows the right thing to do, but organizational constraints make it difficult to take the right action. So personal and professional factors may include perceived powerlessness, past experience, or emotional stability, while some organizational factors may include lack of ethical supervisory support, inadequate staffing, bullying, or lateral violence. And then moral outrage occurs when an individual witnesses the immoral act of another but feels powerless to stop it. So think about the family that has a power of attorney over a loved one, and you know that nothing more can be done, but they continue to fight for more to be done. And then the most difficult of the moral issues is ethical dilemma. So ethical dilemma is defined as making a choice between two or more equally undesirable alternatives. We must be self-aware That's a vital leadership role in ethical decision making, just as it is in other aspects of management. So, if we are agents, nurses as agents, we must apply ethics to everyday problems. The values and norms of nursing provide the foundation and filter from which ethical decisions are made. The way a person approaches and solves ethical dilemmas is really influenced again by their values and their basic beliefs. So, a couple of ethical frameworks that we can talk about to help guide and assist in clarifying personal values and beliefs in order to facilitate a solution of an ethical problem. Teleological is a reason or explanation for something as a function of its end. There's a purpose or a goal. Deontological is the morality of an action that should be based on whether that action itself is right or wrong under a series of rules rather than based on the consequences of the action. So there are 4 commonly used ethical frameworks: utilitarianism, which is teleological, duty-based reasoning, right-based reasoning, and intuitionism, which is deontological. So we're going to look at these a little bit closer. And again, here are your frameworks that we can talk about. So utilitarianism is a teleological theory of ethics, also known as consequentialist theory. This framework encourages decision making based on what provides the greatest good for the greatest number of people. So in doing this, needs and wants are diminished by those individuals. Utilitarianism suggests that the end justifies the mean. Some examples of utilitarianism include employee benefits that pay employee tuition costs if the employee studies in a major desirable for that organization. They could have free on-site daycare. Your book has several different examples. Conferences, they may pay for employees to go to conferences, have insurance programs. Those are all utilitarianism, right? Greatest good for the greatest number of people. When we think about duty-based reasoning, the emphasis is on the manner of action. Nurses act out of a sense of duty. So this does not prioritize the effect on relationships over the nurse's moral duty. So moral correct action is the right action that follows the duty needing to be performed. Rights-based reasoning can be defined as decisions that are made based on the belief that some things are a person's just due, basic claim, or entitlement with which there should be no interference. Individuals have basic inherent rights that should not be interfered with. Rights are different from needs, wants, or desires. So this framework provides a motivation for morality. Intuitionism is the philosophy that fundamental morals are known intuitively. This framework takes each situation on an individual basis, uses intuition to guide the right decision in that situation. This can lead to potential bias and subjective decisions. Ethical principles are a group of moral principles used for ethical reasoning. These should all really be familiar for you from previous coursework, but we're going to go through each one of them quickly and individually. Autonomy promotes self-determination or freedom of choice, so patients are able to make independent decisions. This means that nurses should be sure patients have all the information they need to make a decision about their medical care. Self-determination supports autonomy, meaning the employee has the right to choose to meet the organizational needs or be disciplined further. For management, if employees choose poor behavior, this may warrant termination. Beneficence is doing good. it is closely tied to non-maleficence, which means we do no harm. So basically, if we are in a situation where we cannot do good, then at least we should not do harm. So an example of this is a code situation. What if your patient doesn't want CPR, but a do not resuscitate order is not documented? If the order is not documented, this could lead to a slow code, defined as ineffective resuscitation. Some nurses perceive slow code as a beneficent ethical alternative. And then we talked a little bit about non-maleficence, right? This is do no harm, again, associated with beneficence. If the action one takes cannot do good, then one should at least take actions that do no harm. Paternalism is one individual assumes the right to make decisions for another. So this limits freedom of choice. Most theorists believe that paternalism is justified only to prevent a person from coming into harm. Utility, the good of the many outweighs the wants or needs of the individual. So this reflects the beliefs of utilitarianism framework. We have to be careful that we aren't so focused on the group that we become less humanistic. Justice is the principle of equity. Here we should be elements of fairness. We have to be careful that our care is impartial, but yet also individualized care as appropriate. Veracity, meaning we want to remain truthful. Fidelity is keeping promises. It is our responsibility to keep promises and stick with our commitments. Sometimes our commitments as nurses can be conflicting. The ANA Code of Ethics is clear that our responsibility is to the patient. Confidentiality is keeping that privileged information private. As healthcare providers, we're going to respect people's privacy and uphold HIPAA. There are times, though, when we must override this and report things in cases of like abuse. If a structured approach to problem solving is used, data gathering is adequate, and multiple alternatives are analyzed, even with a poor outcome, the manager should accept that the best possible decision was made at the time with the information and resources available. So there are different types of problem-solving processes. That can include the traditional problem-solving process, the nursing process, and the moral model. So we have talked quite a bit about the traditional problem-solving process. We talked about that in Chapter 1. This consists of identifying the problem through evaluating the results in 7 different steps. You should be very familiar at this point with the nursing process. This is a cyclic process of assessment, analysis, planning, implementation, and evaluation, knowing that feedback can occur at any time during this process. The moral decision-making model incorporates the nursing process and is useful in clarifying ethical problems that result from conflicting obligations. So let's look at this a little closer. When we look deeper into the moral decision-making model, we can follow the mnemonic moral. M is massage the dilemma. This is where data collection occurs about the ethical problem and who should be involved in the decision-making process. O outlines our options. So we've identified the issue and alternatives, and now we're analyzing the consequences of each. R is reviewing the criteria and resolve. Data has been collected, alternatives have been established, and now we need to review and weigh the options against the values of those involved in the decision. A is affirm position and act. Implementation strategies are now put in place. And then L is looking back and evaluating the decision. A common error made by managers in ethical problem solving is using the outcome of the decision as the sole basis for determining the quality of the decision making. If a structured approach to problem solving is used, data gathering is adequate, multiple alternatives are analyzed, we may still have a poor outcome, but it was the best possible decision based on the information and resources that we had. Perhaps the most important thing a manager can do to create an ethical work environment is to role model that ethical behavior. Professional Code of Ethics is a set of principles established by a profession to guide the individual practitioner. Professional codes of ethics function as a guide to the highest standards of ethical practice for nurses. They are not legally binding. Do you have a personal code of ethics? Pause the video here and think about that. What is your personal code of ethics? A code of ethics can provide a benchmark for self-evaluation. Professional codes of ethics do not have the power of law. They do, however, function as a guide to those standard ethical practices for nurses. So what are some strategies that leader managers can use to promote ethical behaviors as the norm? We can separate legal and ethical issues. This can be difficult at times. Legal issues are generally clear and impartial, where ethical issues are much less clear and individualized. We will get into legal aspects of management in Chapter 5, so stay tuned. The second strategy is to collaborate through ethics committees. These committees assist with problem solving and ethical issues. They are interprofessional and are organized to consider significant and difficult issues related to patient care or organizational activities. We can use institutional review boards appropriately. These are your IRBs to protect rights of research subjects. And then we can also foster an ethical work environment. This is the most important behavior to promote, and we can do this by role modeling that ethical behavior. And that concludes Chapter 4. If you have any questions, you can shoot me an email or we'll chat about it in class. Thanks, guys.